Orthognathic surgery are jaw corrective surgeries. These are surgeries which are performed in the upper and the lower jaw, wherein we move the jaws together and correct the bite and make a huge difference into changing the facial profiles. Now, a lot of people are born with facial deformities, or many times as the growth of the child happens, post-puberty especially, around the age of 12 to 14 years of age, many times the jaws grow excessively or sometimes they are underdeveloped. So when the lower jaw is very much significantly overgrown, that is called as prognathism. The jaw is more prognathic. Or if it is underdeveloped, it is called as retrognathism. The same thing can happen even with the upper jaw. It can happen in two dimensions, from front to back, as well as in the vertical dimension. In the vertical dimension, it is called as vertical maxillary excess, wherein your teeth and gums are shown so much that when you smile, not only your teeth are seen but also your gums, and that is called as gummy smile. So these are corrective surgeries which can be very easily corrected with orthognathic surgery. Anybody with jaw misalignment or where there is excessive jaw or underdeveloped jaw is an ideal candidate for orthognathic surgery. Generally, we work very closely with the orthodontists. That's because when the jaw is either overdeveloped or underdeveloped, the teeth which come out through the jaws basically are also not in correct alignment. So there could be crowding, there could be a reverse over bite, what we call as, or something called as a deep bite, wherein the teeth are actually overlapping in excess. In these cases, we will have to work very closely with the orthodontist who is able to align the arches, and once the basic alignment has been corrected or halfway through, we are able to correct the jaw positions by doing orthognathic surgery. So, it's a combined procedure of orthodontics and orthognathic to get the best results. Now, once the permanent dentition is fully erupted, usually it happens between the age of around 10 to 12 years of age, when all the permanent teeth are fully erupted. We wait for many a times the growth to be complete. So the jaw growth generally happens during the puberty phase of life. So we are talking between 12 to 14 years of age when the maximum growth of the jaws happen, and this is in alignment with the general growth of the individual. So a child suddenly becomes a teenager, and that's where you increase in your height, and there is also an accelerated growth of the jaws. Now, around this time is when we actually do a joint consultation with the orthodontist and the orthognathic surgeon. Now, initially we start off with the orthodontic treatment to start with the corrective alignment of the teeth, and once we are somewhere in between or almost at the completion stage of the orthodontics, that is when we address the jaw deformity. So if you have excessive growth of the jaw, that can be now corrected by doing a simple surgery from again inside the mouth, and we basically move the jaws together and fix it with tiny plates and screws to get the perfect alignment of the teeth and jaws. Most of the patients have a changed profile, and that's the reason why we take up orthognathic surgery. So there is going to be a huge difference in the change in profile, and that is for the better. So we try to normalize the facial bone relationships with the rest of the face. So the face has to be symmetrical, the face has to be in balance, and the proportions have to be good, and that is what we address with orthognathic surgery. And as I said, this has to be done during or just at the completion of the growth phase of life. So that is usually in the teenage group of 14 to 16 years of age. That is when we normally address orthognathic problems. Essentially, the surgery is done most of the times from inside the mouth. So there is absolutely no scars on the face. The gums, the usual cuts are made inside the mouth, just below the teeth in the gum area, and we reach the bone there, then we will have to make the cuts in the bone, move the jaws whichever way you want, get it in the right position and fix it with very, very tiny plates and screws. These plates and screws are so tiny that you can't even feel it from outside. So it really repositions the changed new position of the jaw, and a few stitches are put in and they will dissolve by itself. Yes, there will be a bit of discomfort. I won't say major pain, but certainly there will be a bit of discomfort and difficulty in opening and closing the jaws, maybe for a week or so. But generally from the next post-op day itself, we are getting our patients to take soft diet. It's as simple as that these days. Most of the orthognathic surgery are short surgeries. These usually take 2 to 4 hours for us to do the entire thing. But again, sometimes when you have bi-jaw surgeries, that's both the upper and the lower jaws, or when there are things like anterior open bite, that means that the teeth are very much open in the front, so you're not able to chew at all. Those are much more challenging and probably take anywhere between 4 to 5 hours of time to do the surgeries. That's the surgical time we are talking about. Aftercare following orthognathic surgery, like any other surgical procedure which is done inside the mouth, you must take care of oral hygiene. This is very, very important. So the very next day onwards, you can take a small baby brush and start brushing your teeth. Brushing the teeth usually takes care of the hygiene. You also need to basically use mouthwashes and warm salt water rinses. This will help not only in keeping the mouth clean, but also the warm water will increase the blood supply to the area which has been operated, so thereby the healing will be much quicker. Many a times we need to very closely follow the bite, and that is the reason why we may use some elastics to basically guide the bite together, and that is where we need to follow up the patients very rigidly, especially for the first month. Maybe once or twice a week we will have to see the patients to just get and settle the bite with some elastics. So that's the usual thing. But after that, it is basically once in 3 months or once in 6 months following the surgery is what we need to see. Yes, as any other surgical procedures, you will have a bit of pain, maybe a bit of swelling. This usually lasts for a couple of weeks. And that's the reason why we put you on antibiotics and painkillers. Again, soft diet for a couple of weeks, so that really there is no forces exerted on the jaws which have been operated. The long-term complication which you can expect after orthognathic surgery, especially when we have done on the lower jaw, there is a nerve which goes through the jaw, the lower jaw, and this nerve basically supplies sensation to your bottom lip and chin. Now, the crux of the whole surgery is basically to identify the nerve and then preserve the nerve intact. However, many times the nerve gets stretched when we are trying to do these procedures. So there is a transient, that means that for a short period of time, anywhere between 3 to 6 months or sometimes even up to about a year, there might be a bit of altered sensation or numbness in your chin and lip region. Normally these things will recur over a period of time. However, extremely rarely there could be a permanent altered sensation in the chin and lip. Other than that, generally there is no major complication associated with orthognathic surgery. Orthognathic surgery is always done by a specialist, and that's a maxillofacial surgeon. This is where the training comes in, because maxillofacial surgeon understands not only how the architecture of the jaw is, but also the crucial thing is to get the bite right. See, the biggest problem when the jaws are not aligned properly is the bite. And if the bite is not right, there is difficulty in chewing, and eventually it leads to joint problems. And the joint here is basically the temporomandibular joint. These are joints just in front of the ear, which helps us to open and close. So if there is a problem with the alignment, there is always a problem with the jaw joint too. So that is where you need specified training, and a maxillofacial surgeon is the right surgeon to do these orthognathic surgeries or jaw improvement surgeries.